this is the incubator for the innovation that is baked within the federalist system, where states can solve problems that the federal government either is too large or too ossified to solve themselves. And with the first step taken by Texas to engage in direct drug development to address multiple concurrent public health crises within its borders that are representative of the national reality, there is now a chance for other states to come on board and to run over top of federal inaction to bring to the people one of the most forward-moving steps in medical science that we have the opportunity to pursue now.
I'm with Bryan Hubbard here in Fort Worth, Texas at the American Legislative Exchange Council's 2025 State and Nation Policy Summit. And we've been photobombed trying to get set up for this thing. You're a very popular guy here at this conference.
Well, you know, I've always heard even the worst of us will get about 15 minutes at one point in time, so I'm glad it's my turn.
We'll give you at least 5. Okay. Tell me about why you're here.
Well, this has all been a completely unplanned and unexpected journey to speak before 1,000 state legislators about the promise of a natural, the most sophisticated molecule on the planet, which is Ibogaine. It comes from a plant. There have been thousands of Special Forces veterans going back to 2018 who have received treatment with it to overcome what were near fatal symptoms of traumatic brain injury, mental health debility, as well as dependence on a lot of medications they've been given that ain't treated their problems. We have found that it has breakthrough therapeutic promise, not just for them, but for millions of other Americans who are suffering without hope in the face of a medical system that can't deliver what they need. And we're here to try to build on a success in Texas, which allocated $50 million to start an FDA drug development trial and bring other states into the fold to make this the moonshot of our time.
And you started this in Kentucky.
Yes, sir.
You were on the opioid commission there?
I was the first chairman of the state's opioid commission and had proposed that we take 5% of the state's settlement funds, or $42 million, to build the public-private partnership that was ultimately adopted in Texas to take on this project. We were on the threshold of success, and we had some unfortunate political interference that used folks in office like a pair of gloves to keep their fingerprints off the assassination of the project. But what was killed in Kentucky was revived in Texas, and now we're on the cusp of starting a national movement to make this a reality in America.
You're about to head to the task force right after this, and you're hoping that coming out of this meeting will be some model policy other states can take and replicate what's going on here in Texas. Is that sort of the idea of everything you're believing in, getting this spread across the country?
Yes, sir.
State by state by state?
Yes, sir. As I heard ALEC describe, this is the incubator for the innovation that is baked within the federalist system, where states can solve problems that the federal government either is too large or too ossified to solve themselves. And with the first step taken by Texas to engage in direct drug development to address multiple concurrent public health crises within its borders that are representative of the national reality, there is now a chance for other states to come on board and to run over top of federal inaction to bring to the people one of the most forward-moving steps in medical science that we have the opportunity to pursue now.
Doesn't sound like there should be any opposition to it, but what's holding things up?
Well, you know, you got some folks out there that would rather treat symptoms over the course of somebody's lifetime than give them something 2 or 3 times their entire life that might fix their problem. You got a lot of money in treating symptoms but never making people better. And this is something that has the potential to make people better. So if you make money on sick folks, you're not necessarily going to be wrapping your arms around this.
Right. You have had many conversations with Governor Rick Perry, and in our lunch today, what you and Rick Perry talking about? Trying to really team together on this?
You know, Governor Perry.
I know you're both very spiritual.
Oh, the relationship that I have been able to develop with Governor Perry has been one of the greatest blessings in my life. And he and I have discovered that we have kindred minds, hearts, and souls on the necessity of reconnecting human beings to their divinity. Right. To have the chance to live life as a human is a rare, special, and it's a divine reality. And we believe that this medication not just heals the mind and body, but it has the capacity to affirm the reality of the soul for people who've never felt it. And how can we possibly deny any human being that chance if they so choose to take it?
Now you're up on stage talking to these state legislators, but into the camera, what's your message for the state legislature?
Thank you all for being public servants who are willing to sacrifice your time, talent, and treasure to serve your fellow person. One of the greatest things, perhaps the greatest thing you can do, is make an individual impact to advance a divine emancipation medication that has the potential to lift up and transform millions of lives in a way that nothing else can. It's a multi-lifetime opportunity to make a generational impact that will change the lives not just in the United States, but globally. Thank you for your willingness to listen, and more importantly, your determination to act.
Well, from the State and Nation Policy Summit here in Fort Worth, thank you, Bryan Hubbard.